Let's go through the basic anatomical structure of the foot. The foot is divided into 3 sections: the forefoot, midfoot, and hindfoot. The hindfoot contains the 7 tarsal bones of the foot that are irregularly shaped and form the ankle region. These bones are further divided into 2 rows. The proximal row contains 2 tarsal bones. These are the talus and calcaneus bones. Together, these form the heel area in the hindfoot. The distal row contains 4 bones in total. These bones are 3 cuneiform bones, the medial, intermediate, and lateral cuneiform, as well as the cuboid bone. Another bone, the navicular, is interposed between the talus and the 3 cuneiform bones. In other words, it is interposed between the proximal and distal rows. To help remember the names of these tarsal bones, try using the mnemonic. The circus needs more interesting little clowns. The capitalized words are the ones you should focus on. Here, T is for talus. C is for calcaneus. N is for navicular. M is for medial cuneiform. I is for intermediate cuneiform. L is for lateral cuneiform. And C is for cuboid. Those were the 7 tarsal bones of the foot. Now, let's take a closer look at the bony landmarks of these bones, starting with the talus bone. The talus bone has the head, neck, and the body. This is the head. This is the neck, and this whole part here is the body of the talus. If you look at it from this angle, you will be able to see the trochlea of the talus. The trochlea of the talus is a convex articular surface for articulation with the tibia and fibular bone. 2 tubercles can be seen in the body area of the talus. This one is the medial tubercle of the talus, while this one is the lateral tubercle of the talus. The talus bone also transmits the weight of the entire body from the legs to the foot, and has the highest proportion of its surface area covered by articular cartilage of any bone in the human body. Moving on to the calcaneus, the largest of the tarsal bones, it's also known as the heel bone and has a calcaneal tuberosity. Looking at its inferior surface, this here is the medial process of the calcaneal tuberosity, while this part is the lateral process of the calcaneal tuberosity. The peroneal or fibular trochlea is located on the lateral aspect, while the sustentaculum tali is found on the medial aspect. In the distal row, the navicular and cuboid bones both have tuberosities, with the cuboid bone also featuring a groove for the fibularis longus tendon. The 3 cuneiform bones have a wedge-like shape. The base of the first metatarsal bone bears a big kidney-shaped facet on the distal side of the medial cuneiform, and its hilum is pointed laterally. At the proximal and distal surfaces of the intermediate cuneiform, there are triangular articular facets. Along its posterior boundary, a vertical facet identifies the lateral surface. The lateral cuneiform bone has this aspect. Finally, the upper 2/3 of the lateral cuneiform include a triangular facet for the navicular bone. A triangular or oval facet for the cuboid appears on the lateral surface in its posterosuperior region. Moving on to the metatarsal bones, there are 5 in total that articulate with the bones in the distal row of the tarsals. Interestingly, the navicular bone doesn't articulate with the metatarsals, which is why it's not included in the distal row. The tarsometatarsal joints, which are formed between the tarsal and metatarsal bones, play a vital role in the stability and flexibility of the foot. With 5 joints in total, each joint has a unique structure that allows for the necessary range of motion needed for activities such as walking, running, and jumping. The first tarsometatarsal joint is in between the medial cuneiform bone and the first metatarsal bone. Second 1 tarsometatarsal joint is between the intermediate cuneiform bone and the second metatarsal bone. Third joint is between the lateral cuneiform bone and the third metatarsal. The fourth and the fifth tarsometatarsal joint is in between the cuboid bone and the fourth and fifth metatarsal bones. Just how these metatarsal bones form joints with the tarsal bones proximally. It also forms articulations with the bones distally called the metatarsophalangeal joint. The metatarsophalangeal joint is formed by the connection of the metatarsal bones and phalanges. Each phalanx consists of 3 bones, except for the first phalanx, which has only 2. The first bone in each phalanx is referred to as the proximal phalanx, the middle bone as the middle phalanx, and the last bone as the distal phalanx. However, the first phalanx in the foot lacks a middle phalanx due to having only 2 bones. The joint between each phalanx bone is called the interphalangeal joint. Each phalanx, except for the first, has 2 interphalangeal joints. Who knew that something as seemingly simple as our feet could be so complex and fascinating? The bones in the foot connect to each other and create multiple joints, which are supported by ligaments that are crucial for maintaining stability in the foot. As the foot bears the weight of the lower limb, its stability is of great importance. I will discuss these joints in detail in a separate video. For now, we will look at some of the important ligamentous structures in the foot. These are flexor retinaculum, extensor retinacula, fibular retinacula. Flexor retinaculum. The flexor retinaculum is a fascinating anatomical feature that plays a crucial role in the movement and function of the foot. This strap-like layer of connective tissue not only attaches to important bones in the foot, but also serves to convert grooves on the bones into tubular channels for the tendons of the flexor muscles. These channels are then surrounded by synovial sheaths, which facilitate the free movement of the tendons. What's particularly interesting about the flexor retinaculum is that it is continuous with both the deep fascia of the leg and the plantar aponeurosis of the foot. Overall, the flexor retinaculum is a vital component of the foot anatomy that deserves careful study and consideration. By understanding its structure and function, we can gain a deeper appreciation for the complexity and sophistication of the human body. Next is the extensor retinacula. To extensor retinacula strap the tendons of the extensor muscles to the ankle region and prevent tendon bowing during extension of the foot and toes. A superior extensor retinaculum is a thickening of deep fascia in the distal leg just superior to the ankle joint and attached to the anterior borders of the fibula and tibia. An inferior retinaculum is Y-shaped, attached by its base to the lateral side of the upper surface of the calcaneus, and crosses medially over the foot to attach by one of its arms to the medial malleolus, whereas the other arm wraps medially around the foot and attaches to the medial side of the plantar aponeurosis. On the lateral side of the proximal foot, a compartment accommodates the passage of the extensor digitorum longus and fibularis tertius tendons. The dorsalis pedis arpri, the tendon of the extensor hallucis longus muscle, and finally the tendon of the tibialis anterior muscle all pass beneath the extensor retinacula medial to these tendons. Lastly, We have the fibula retinacula. Fibular or peroneal retinacula bind the tendons of the fibularis longus and fibularis brevis muscles to the lateral side of the foot. A superior fibular retinaculum extends between the lateral malleolus and the calcaneus. An inferior fibular retinaculum attaches to the lateral surface of the calcaneus around the fibular trochlea and blends above with the fibers of the inferior extensor retinaculum. At the fibular trochlea, a septum separates the compartment for the tendon of the fibularis brevis muscle above from that for the fibularis longus below. That is all about the general anatomy of the foot. Let's jump in and talk about the dorsum and the sole of the foot.
Have you ever heard of video books? sqadia.com is delighted to present video books, medical books that have been tailored into a series of videos. sqadia.com videos are presented in the same order as the book's chapters. Explore now and make your learning easy.